draw too many firm conclusions from preliminary results. I think we do need to prepare ourselves, as you say, ensure that we have a comprehensive system in place to find cases, test cases, isolate cases, carry out contact tracing, ensure that contacts are quarantined, make sure that we have appropriate and adequate care facilities for individuals who need care for COVID and for other diseases, so that we empower our community so that everyone knows what they can do to prevent themselves from getting infected, focusing on public health measures with the hand hygiene, the physical distancing, wearing a mask where appropriate. All of these measures need to be put in place now.
Thank you very much, Dr. Van Kerkhoff. So we're coming up to the hour. We've got a lot of questions, and I apologize for all those who didn't get their question asked, but I think we'll have to make this the last question. And it goes to Musa from the Geneva Press Corps. Musa, please unmute yourself and go ahead.
Yes, can you hear me? Can you hear me? Yes, thank you very much. So my question concerns the developing countries, especially in Africa. The G20, if they haven't lived up to their pledges, so what is the situation in these countries, in the poor countries, in the developing countries, especially in Africa, when it comes to the economic, social and health concerns? Thank you.
I think that's a question for Mr. Lowcock.
Well, thank you very much indeed. So let me start by saying a few things about the set of problems and challenges that countries in the continent face as a result of the COVID pandemic. The first is economic. They're affected by the global economic contraction, and some of the measures around lockdown and so on have affected them as well. So there are large numbers of people now in the continent for whom it's harder to make a living than it was before the crisis. Secondly, they're affected by what we observe as enormous pressures on the health system. Immunization rates, probably the best investment to save a life is to vaccinate a child against the killer disease. Immunization is under pressure, is not being sustained in lots of countries. Malaria prevention control is under pressure. It's harder to sustain basic services for pregnant women and for newborn children. HIV prevention treatment is getting harder to sustain as well. In addition, we're seeing a plague of gender-based violence, a global plague actually, not just in developing countries, but in other places. But women and girls in poorer countries are suffering from that as they are in other places. Now, what we want to see is support to African countries who don't have the same resource base as some other countries elsewhere around the world. We want to see more support for them as an act of human empathy and generosity, but also in the interest of the wealthier countries. And we have seen some generous funding for our humanitarian response plan for COVID-19. As I said earlier, we've raised $1.7 billion so far. But we need to raise a lot more. And the basic problem we have at the moment on the humanitarian side is needs are growing very dramatically. I think there'll be a need for $40 billion worth of assistance to protect 250 million people from humanitarian crisis this year. The needs are growing very dramatically. And although the funding is growing too, the funding is growing very slowly. So the gap between the need and the funding is growing. But we're also seeing another compounding problem, which is that more countries are coming under economic stress and are being dragged down into the category of that countries which has humanitarian caseloads and people who can't survive without help. And that's where I really think the G20 need to step up to resource the international financial institutions, the IMF and the World Bank and other institutions better to help avoid a situation where more and more countries come into these acute levels of crisis and the rules get changed on the basis of which the international financial institutions support those countries. So the money moves faster, more efficiently, but crucially, most of all, to the countries with the biggest problem. Thank you.
Thank you very much, Mr. Lowcock. And Dr. Ryan's got something to add.
Now, just to support what Mark has said, and in the particular context of COVID-19, many countries are really taking a huge impact on the humanitarian front, on the development front, on the health systems front. And this is causing huge strain on overseas aid, ODA, and donors who would traditionally be supporting development and health systems are strained by that because governments are also trying to take care of crisis at home. So equally, humanitarian donors in the same situation. And I think while trying to sustain overseas development assistance and aid and humanitarian intervention, I think we also need to accept that supporting countries for COVID-19 in humanitarian settings or in fragility, or supporting humanitarian response in general in those settings, it's not just a humanitarian issue. It's not just an interrupted development issue. It is now globally about continued economic prosperity on this planet, because unless and until COVID-19 is controlled everywhere, it is a risk everywhere. And it will continue to threaten the world economically. It will continue to threaten the world politically until we get rid of this virus or bring it into control. Therefore, we cannot ignore the fact that over 2 billion people live in contexts of poverty, exclusion, fragility. It is not purely a development or humanitarian issue, and neither is it purely an economic issue. It is an issue of global security. It is about global health security, but ultimately, if not managed, and if these contexts are not stabilized and managed, they themselves will worsen conflict and will drive further instability. And I think it's time, and Mark has laid this out very, very clearly in the documents that he and his teams have produced. This is much more than a development and humanitarian issue, and the world needs to wake up to that reality if we want to effectively deal with COVID-19 going forward. Do you want to see anything?
Thank you very much, Dr. Ryan. Okay, I will now close proceedings, but I will first apologize for some of the problems with the sound and with this live streaming on social media, but we'll make sure that we will post it all on the web, and we'll send you the links, and we'll also provide the transcript. Now I'll hand over to Dr. Tedros to close proceedings.
Thank you. Thank you, Margaret. At the beginning of today's briefing, I quote the remarks made yesterday by the Spanish nurse Aroa Lopez. One of the other speakers at yesterday's memorial was Fernando Hernandez Calleja, who lost his brother to COVID-19. I want to finish by quoting him. This is what he said. More than kindness, more than love, compassion is the emotion that most makes us human. Compassion allows us to understand the pain of others, their thwarted aspirations, their sadness. That's why I'm asking today for your compassion. I want to echo Fernando's call to the whole world. More than anything, we're asking for your compassion. This pandemic can only be defeated when we unite and through compassion. Thank you, and have a nice weekend. And thanks, Mark, also for joining us today. Thank you, and all those online for joining. Thank you so much. Have a nice weekend.
The health security of the world is threatened by the fact that there are not strong surveillance and response systems in place in these fragile settings. That's a threat to the people in those areas, and that's a threat to the world. So as the cost of doing nothing and the cost of non-intervention is not just in the areas, it is a global consequence of inaction. And we really need to look at that. Secondly, when we look at our collective goals, in terms of reaching the Sustainable Development Goals and bringing better health and social justice to the world, the fact is that the highest rates of maternal child mortality are occurring in
reports about whether or not people can be reinfected with COVID-19 after getting the virus and then being cured. What is the WHO's current assessment of this? Thank you so much.
Thank you for the question. Yes, this is an important question that we've been asked quite a lot lately in terms of if someone can be reinfected with COVID-19. So what we understand, this is an area of active research by scientists all over the world, clinicians all over the world. What we understand from people who are infected with the SARS-CoV-2 virus, the virus that causes COVID-19, is that they will develop an immune response. They will develop antibodies, neutralizing antibodies, and an immune response that will provide some protection against reinfection. What we don't know right now is how strong that protection is and for how long that protection will last. And we need answers to those questions to be able to determine if someone can be reinfected after that immunity wears off. So this is an area of active research for the specific SARS-CoV-2 virus. We do have some answers for other viruses, the MERS coronavirus and the SARS-CoV-1 coronavirus, which emerged in 2003, indicating that people have an immunity that lasts over 12 months or so and maybe even longer. And we have some results from the human coronaviruses, the common cold coronaviruses that circulate the globe regularly, and your protection lasts a lot shorter than that. So we don't have a complete answer, but it is an area of active research, and I should say an active collaborative research all over the world.
Thank you very much, Dr. Van Kerkhoff and Dr. Ryan. Now we have a question from Bianco from Globo in Brazil. Bianca, please go ahead. Unmute yourself and please go ahead.
Hi, Margaret. Can you hear me?
Very well, Bianca. Please go ahead.
Many thanks for your attention, for taking my question. Journalist from Globo News and Globo TV, Brazil. I know that Brazil is between the 63 countries that Mark Lowcock mentioned, where people need humanitarian assistance. So I would like to hear from Mark, how concerned are you, Mark, with the situation there in Brazil? And from Dr. Tedros or Dr. Ryan, if they can give us an updated general view of the challenge Brazil is facing now with more than 2 million cases. Thanks a lot.
Okay, this one's for Mr. Lowcock. So we'll go to Mr. Lowcock first, and then we've got some things to say in the room too.
Well, thank you very much. The main activity of the humanitarian agencies, which I coordinate in Brazil, relates to support for Brazil in the way they are helping people who've left Venezuela. And Brazil, like Colombia, Peru, Ecuador, a range of other countries, is taking a large burden of helping support millions of Venezuelans who, for reasons everyone's familiar with, have in recent years left their country. Now, it's probably important for me to recognize that Brazil itself has a very substantial problem. And I know that Tedros and Mike will talk about WHO's perspective on that and the support and so on. But what the humanitarian agencies do is focus their effort on the very poorest countries. So Brazil, country obviously which has developed a lot over recent decades, has typically not needed assistance from humanitarian agencies in the way, say, some African countries or some countries caught up in conflict have done. So we do not at the moment, and we hope we never need to have a strong engagement of the humanitarian agencies in dealing with the crisis in Brazil, because Brazil has built up a lot of capability of its own through the process of development. So I think that's probably what I can say on this topic, but I know that Tedros and Mike will have other things to add.
Yeah, I can make some general points. Again, the number of daily in